Hey guys, I just wanted to show you.
Child with limping X-ray shows Perthes disease. You are a GP when a 6-year-old child was brought by mom because of limping on the left side. So task is history, physical examination, diagnosis, and treatment. The chief complaint was limping in X-ray was given in exam to know it is a Perthes disease. Chief complaint for how long he had limping. Is he limping on one or both sides? Does he have any pain? Number 2, pain question severity, sudden or gradual, constant or come and go. Sight and radiation character, anything make it worse, like movement or better like rest enhance. This happened before number 3, differential diagnosis, tummy pain. In rash, fever, joint swelling, recent infection, trauma. Sure, let's break down the approach for a 6-year-old child presenting with a limp suspected to have Perthes disease. History taking, chief complaint. Duration, how long has the child been limping? Side, is the limping on one side, left, or both sides? Pain. Severity, how severe is the pain on a scale of 1 to 10? Onset, was the onset sudden or gradual? Nature, is the pain constant or does it come and go? Location, where exactly is the pain? Does it radiate anywhere? Character, what is the nature of the pain, e.g. dull, sharp, throbbing? Aggravating factors, does movement make it worse? Relieving factors, does rest make it better? Previous episodes, has this happened before? Associated symptoms, tummy pain, any abdominal pain? Rash, any skin rashes? Fever, any recent fever? Joint swelling, any swelling in the joints? Recent infections, any recent infections? Trauma, any history of trauma or injury? Physical examination, general examination, check for fever, rash, and overall appearance. Gait analysis, observe the child's gait to assess the limp. Hip examination, inspection, look for any swelling, redness, or deformity. Palpation, check for tenderness around the hip joint. Range of motion, assess the range of motion in the hip joint. Special tests, perform tests like the Trendelenburg test to assess hip stability. Diagnosis, based on the history and physical examination and considering the X-ray findings, the diagnosis is likely Perthes disease, Legg-Calvé-Perthes disease. Treatment, non-surgical management. Rest, encourage rest and limit weight-bearing activities. Pain management, use analgesics like acetaminophen or ibuprofen for pain relief. Physical therapy, engage in physical therapy to maintain hip mobility and strength. Bracing, consider using a brace to keep the femoral head in the hip socket. Surgical management, in severe cases, surgical intervention may be required to improve hip joint function and prevent long-term complications. Follow-up. Regular follow-up is essential to monitor the progression of the disease and adjust treatment as necessary.